Hi, this is Heidi Gilbert. I am the Emergency Department Clinical Educator and SANE Program Coordinator here at SMC. I'm going to talk to you today briefly about the neurobiology of sexual assault. Now, while this is focused on sexual assault, this is relevant to any type of severe trauma, whether that's an active shooter or a car wreck or workplace violence if you're assaulted. Any type of severe mental trauma where you feel like your life is in danger, this is how the brain responds to that and works. And so I hope you take some nuggets away from this and enjoy this presentation. Okay, I'm going to start with a little A&P of the brain. So here's your cross section. Starting at the bottom, this yellow area is the reptilian brain. It is the oldest part of the brain in evolution. So the simplest of creatures have a reptilian brain. It includes a brainstem and a cerebellum. This is your autopilot. It controls your heart rate and breathing and temperature, things that you don't have any conscious awareness of. So your basic bodily functions are controlled by the reptilian brain. And as we move up into more complex animals, we get to the mammalian brain. It was the next thing to develop. This is also known as your limbic system. It controls your emotions and memories and helps you develop habits. This is important in evolution because if you think of Neanderthals and hunters and gatherers, it was important for them to be able to spot enemies or spot dangerous situations to stay alive. So this is where you remember dangerous situations, and if you're caught in that again, you remember the feeling of that. You're anxious, you are more hyper aware, alert. And that is the function of the mammalian brain, or your limbic system. It attaches emotions to memories. This is your fight or flight center. And then lastly, you have the neocortex. This is the top part, this purpley blue color, and it develops last. So only the highest functioning mammals have a neocortex. And again, it takes the longest to work also. It is the smartest part of your brain. It's how you know how to mix a dopamine drip or know ACLS algorithms. That comes from your neocortex. It is the smartest, most effective part, to some extent, your brain, but it takes very long for the synapses to connect and for it to work. So it is not the most effective when you need to make quick decisions. It will make the best decision, but it takes too long, and by then you might be dead. This is where all of your reasoning and rationalization comes from. So now moving over to dive in a little bit more. These areas of the brain are going to be very important when we start talking about the neurobiology of sexual assault or the neurobiology of trauma in general. So your hippocampus, it is important in storing and memory. So it stores your memories, it stores the things that you've learned and creates memories where you can recall them later. I remember the hippocampus because you would always remember a hippo on campus. These are my word associations. Next we have your amygdala. Your amygdala is your fire alarm for your brain. This reacts to stress, any type of emotional arousal, and it lets everybody know, all the parts of the brain, your body know something is amiss. And so it is your alarm system of your brain. And I remember that because amygdala sounds like a scary monster. So it is the scary alarm of your brain. And then lastly, we have your prefrontal cortex, and that is part of that neocortex, and it is the very smartest part of the smart part of your brain. This regulates your thoughts, your emotions, and your behaviors, and it puts things into perspective. That, no, that's not actually a snake, that is a stick. But it takes, again, it's the slowest part of your brain because it's going to get the right answer, but it may take longer to get to that point. And I remember that just because it sounds like a very smart word, the prefrontal cortex. It's the very smartest part of your brain. Okay, so now we're going to talk about the brain under threat. And again, we're going to use a bear in this analogy. And this bear can be a rapist. It can be an active shooter. It can be a major car wreck. It can be anything your brain is under threat for. So for our purposes, a bear is going to be our rapist. So when the human brain senses a life-threatening event, some of the sensory information bypasses the neocortex. Here we go. It's going to go right over that really smart part of your brain, and it's going to go straight to the defense circuitry. So I don't have time to make a really smart decision. I need to make the fastest decision that's going to save my life. So this includes the amygdala, part of your brain's limbic system, which predicts dangerous stimuli and triggers the appropriate physiologic response to danger and a threat. This is automatic and often largely unconscious. And I can't emphasize enough that this is unconscious. You cannot control this. So this signal is skipping the smart part of your brain, going straight to the alarm center, where your amygdala is going to scream and let everybody know something bad is happening. So now that the amygdala is involved, your fire alarm center, it sends a message to another part of the brain called the hypothalamus, which then sends a message further down in the brain to the pituitary gland. And your pituitary gland signals to your adrenal glands to start pumping out hormones. And these hormones are important to save your life. Some of the hormones are adrenaline and cortisol. And it will also pump out opioids and oxytocin. So your adrenaline is going to help your fight or flight. So it's going to help you run from the bear. It is going to constrict your blood vessels and make your heart pump faster and harder to get blood to the brain and to your legs so you can run away from this bear. Cortisol is the other stress hormone and is released by the adrenal glands. And this suppresses the body from doing anything that isn't necessary. So you're not going to be digesting your food. You're not going to have any kind of higher cognitive processing because we don't have the energy for that right now. We just want to save our skin. So this allows the brain and the body to focus all of its resources into dealing with this one specific threat. The defense circuitry rapidly takes control of all of the brain functioning. And then your opioids are released because it's going to help you, the bear attack, not be as painful. And so it's going to protect your body as much as possible from this oncoming painful experience. And then oxytocin, is the hormone of general good feeling. And it releases in order to make you feel better about being mauled by this bear. And you know what we're talking about when we talk about bears. And again, this is the hypothalamic pituitary adrenal axis, HPA axis. Okay, so now let's go back to Mr. Hippocampus. So your hippocampus, again, remember, is important in formulating your memories. And so how it does that is first it organizes all of the sensory information and consolidates it in ways that make sense for your brain. And so it's going to take random things, say the color green, a smell, it smells like smoke, all of these things that don't make any sense, and they're going to start pairing them together and putting them into these categories you can see at the bottom right. So all of the colors, and it's going to try to put things in context to create a story. And so you can now recall a story of all of these tiny little pieces, fragments of information into something that makes sense. That's what your hippocampus does, and it's very good at doing that. Except the hippocampus and the amygdala are very sensitive to hormonal fluctuations. And remember what's happening with that HPA axis is you are surging all of these hormones through your body that is making this nearly impossible for your brain to consolidate and store these memories. And you don't have any control over that. So let's dive a little bit deeper into memory and how memory is laid down. So there are 4 different types of memory, kind of in 2 separate categories. Explicit memory is a conscious, intentional recollection of factual information. Implicit memory is more of a recollection of acquired and used unconscious facts and memories that can affect your thoughts and behaviors. So some examples of that: explicit memory, you can have semantic memory, and this is general facts and knowledge. So who was the first president? Who was the 14th president? How do you mix, again, a dopamine drip? What is the first joules of defibrillation? These are semantic memories, and these are facts. When we relate it to like a sexual assault, like what were the specific, how was the room laid out? Was the bed against the east wall, the west wall? Was there a chair? Very specific facts of a situation. Your episodic memory is more of this autobiographical memory, a timeline, the who, the what, the where. What did you eat for breakfast? How did you get to work? What did you do throughout the day? In a sexual assault, like the timeline of this is what happened, this is how my pants got off, this is how what he said, this is what happened after this person said this. It's the timeline of things. Alternately, in your implicit memory, things like your procedural memory is how you perform tasks that you don't even think about. How you drive your car, how you tie your shoes, how you start an IV. You don't even think about these things. You've done them 100 times, and that is embedded into your memory, but it's not anything that's conscious. And then finally is your emotional memory, how you felt during an experience. And those are very visceral, unconscious types of memories. Your implicit memory is. Your explicit is very intentional. So let's talk now about how trauma directly impacts these 4 different types of memory that you have. Under this explicit or intentional memory, remember, semantic memory is the specifics of an event. So trauma prevents information like the words, the smells, specific images from different parts of the brain from combining to make a semantic memory. What this means is that somebody may forget very important or even innocuous details of an event. Someone may forget something as important as somebody was holding a gun when this happened. That could not have ever been encoded and stored. Or smaller details, like where a chair was, what color clothing was somebody wearing. These may not be stored at all during traumatic events. Now, in episodic memory, trauma shuts down this and stores things in fragmented pieces rather than an absolute timeline, this very start to finish type of memory. And why this is important is you might ask a patient directly after a trauma what happened, and we'll talk about here in a minute how that memory looks to them, and like, wait, start from the beginning. They can't. They cannot start from the beginning because that is not how the memory was encoded into their brain. It is very fragmented. We talk about implicit memory, like your procedural memory. Remember these things that you do without any conscious thought of. So you might notice yourself around certain family members or just certain people that your body tenses up, your posture changes, and you don't even realize until this person leaves how you kind of exhale, and you're not as tight as you were. You just have this uneasy feeling around some people. Trauma, that is a trauma response. And then your emotional memory, after a trauma, somebody can get so triggered by these painful emotions without any context. And so I've read instances where somebody is sexually molested at a very early age, say by somebody that wears a certain cologne, or somebody that has a certain kind of briefcase or wears a red bow tie. And now, while those specific semantic memories might not have been laid down, you still have these core unconscious memories of that. And this is where people have panic attacks anytime they have a certain smell or they see somebody in a red bow tie. But there's no context in that. I don't know why every time this happens, I get upset or my heart rate goes up. So this is what trauma does, is you still may have this emotional memory, this visceral feeling to the extent of panic attacks, but there's no context that A goes with B. And these are textbook signs of PTSD. This is where it comes from, is some major traumatic event, and you have this feeling of unease or chronic pain from this constant tense feeling in your back or your arms or your body. So these people can have chronic pain or panic attacks, to the extent of having literal panic attacks with no context to why this is happening. Okay, so here is how I talk about how trauma memory works. And so imagine, and I speak about this at conference, imagine that you are at a conference, and instead of a nice long legal pad where you can write notes, or your iPad or whatever you're going to take notes on, I'm just going to give you these 1-inch by 1-inch Post-its. And you have to write everything that you learned at the conference for 4 days on these Post-it notes. Now, the information on each individual Post-it note is going to be accurate. Okay, so you're writing down accurate notes on all of these Post-it notes. So here are you had a welcome party, or for the conference at 7:30, your plane landed at 10:10, you got a sugar-free iced vanilla latte, you stayed at the Manchester Grand Hyatt. These are some things that you learned about dope and FOCA, or who knows, whatever you learned at. So all of the individual Post-its are accurate information. But then I'm going to get you to crumble all these tiny little Post-its up, and we're going to find the world's messiest desk. No, this is not my desk, but we're going to find the world's messiest desk. And I want you to cram these little Post-its, these crumbled up Post-its, into all kinds of nooks and crannies, and there's hundreds of these. And some of them may just be right on top, and that may make sense. The other ones that I want you to open up a stapler and put it inside the stapler and close the stapler back up. Or take that picture off the wall and you're going to put one behind that picture frame and then put it back together and hang it back up on the wall. So some of them you may never find, and some of them you may find weeks or months or years later when you're looking for something. You're like, what is this Post-it? So they're very difficult. Some may be very easy to retrieve, and some may be very difficult to retrieve. So now your boss asks you, I need you to tell me everything that you learned at this conference that I paid for you to go to. So you find this Post-it. That was the first one that you could find on top of your desk. And I say, land 1010. And they're going to look at you like you have 3 heads. Like, what does that even mean? Is that accurate information? It's accurate. I did land at 1010. But if I don't have context on my plane landed at 1010 on Friday, then that makes no sense, because there's no context to that. And it doesn't go, I need all of the other information for that to make sense. And here's another example. Say that you just got that part of the Post-it, somehow it got torn off. So now instead of a sugar-free iced whatever latte I had, I just have SF ice. Well, that makes even less sense. I don't even know what that means. So then we add to that, say that there's drugs and alcohol involved. Now you have a blank Post-it. There was nothing ever even written on that. So that can affect, imagine you trying to tell a story of what happened, and I don't have that Post-it yet. But then if I find it 2 weeks, 2 months later, now you're, all of a sudden your patient, your victim, yourself, you look like a liar. Like you just made that up. No, I just found the Post-it though. So it takes time to gather all these things up, and it takes, research has shown that it takes at least 2 sleep cycles. So somebody needs to sleep 2 times. So 48 hours later to kind of consolidate these memories, to have the best chance of having a meaningful linear story. And oftentimes we don't do that. We ask someone right away, they come into the ER right after a terrible event, and we're asking them to tell us what happened, and they don't make any sense because they're telling you this part and this part. You're like, whoa, 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 start from the beginning. They can't do it. And they need to know that that is very, very, very normal. And so if they're saying things that don't make sense, please know that that is very, very normal. So, like I said, your unconsolidated memory is very fragile. You cannot retrieve memories right after an event. You cannot effectively retrieve memories. It takes, again, the 2 sleep cycles to consolidate things. I read that officers involved, police officers, law enforcement involved in an officer-involved shooting are given 2 full sleep cycles before they're asked to give a statement. Because how bad would that look for an officer to say right after the fact, say, you know, write this statement out, this is what happens, and after those 2 sleep cycles, they're able to consolidate things and like, wait a minute, no, that's not how it happened. That wouldn't go over very well. So stress and fear also heighten the amygdala, and remember, all of those hormones are going to affect your memory. And so it's going to affect that explicit memory, and you're only going to store things in fragments in emotion. So that explicit memory of the autobiography of what happened and the context of very specific things in the room, those hormones really affect that, where you're going to only encode how you felt about it and certain fragments of things, and that you're going to hear someone say it was just all a blur. So let's change gears here a little bit from memory and encoding and the A&P of things, and talk about behaviors during and immediately after a sexual assault. So I know we commonly here refer to the fight or flight response to traumatic events, and that's how your sympathetic nervous system responds, fight or flight. When it comes to sexual assault, victims actually rarely fight or flight. So you rarely find, it's not like TV where the victim physically fought and punched and scratched and kicked like you think, or rarely run away. And why is that? Well, the first thing is lack of training. Most women, men, are not trained to fight. Even if some have taken like a self-defense course, most have not had repetitive training to make this an automatic response. And we'll talk here in a little bit about how you will always revert to your habits and reflexes. And so that's why victims of sexual assault rarely do fight or flight, because we'll talk about what those habits and reflexes are. Unless you are repetitively trained to have that trained out of you, you're not going to have these skills. So yes, why rape defense courses are fantastic, and I recommend them, unless that you have repetitive training where this is second nature to you and you don't have to ignite that prefrontal cortex. I wouldn't put a lot of weight in that is how you're going to respond in that situation. And then on top of that, you have this known offender and this cognitive dissonance. And this is just a funny video that I found about how, like, if you don't repetitively train, this is what your defense is going to look like. But on top of any type of traumatic experience, especially with sexual assault, is that you might have a known offender and you cannot connect that this person that I trust, that I thought was a good person, that I let my guard down, is that you know this person, it is not a stranger out of the bushes, and you have this cognitive dissonance of like, I can't put that together. This is especially difficult for men, and we'll talk about here in a bit specific responses and these freeze responses. And men have an especially high, this cognitive dissonance is like, I never thought that this would happen to me. Like women, you don't think that this is going to happen, but in the backs of our minds, just culturally, we all know that it's a possibility. So you don't walk to your car at night by yourselves and you hold your keys a certain way. So this is in the back of women's minds, but not in men. And so when men are victims of sexual assault, they have a severe cognitive dissonance and even a more pronounced freeze response because their brain cannot compute that this is what's happening to them. So I'm going to talk here briefly about specifically how women cope when there's no escape or no perceived escape. So women will respond in a few different ways. Most commonly, they will dissociate. So kind of go within yourself or go without of yourself and just dissociate from what's actually happening. Another very common response is this tonic immobility. This is also called rape-induced paralysis. This happens to about half of victims of sexual assault. It is more common if someone has a history of sexual assault or prior sexual abuse, molestation, something along that line, that just this tonic immobility where survivors will say, I just couldn't move. I felt paralyzed in fear. I couldn't move my arms or legs. That is kind of paired with a collapsed immobility, and this is more like fainting goat. I just completely collapsed and couldn't move. And finally, this fawn, or I call it tend and befriend. And in trauma, you will always revert to your reflexes or habits. So, aside from the very smart part of your prefrontal cortex making very calculated and correct and thoughtful decisions, your core fight or flight, that limbic system, is going to revert to reflexes and habits. And all of these here on the left fall into that. So just dissociating or this immobility is a reflex. You cannot control it. It's just like, again, fainting goat. This happens unconsciously where somebody goes within themselves, or I felt like I was watching it happen from above, this dissociation. And that is a uh, protective way that your brain will keep you from feeling all of the trauma, whether that is physical, emotional trauma. If you dissociate, then it doesn't impact you as hard. The tonic immobility is just being paralyzed, whether that's tonic immobility or collapsed immobility. That is a evolutionary reflex to where, like you say, if a bear is running at you, you're supposed to play dead. So if you play dead, then maybe this won't happen. And then this habit is this fawn. And this is, again, very culturally ingrained into women, is to be nice, be polite, smile. And so again, this is very viscerally ingrained into women, is this tend and befriend. If I'm nice enough, if I am polite enough, if I act like I am this person's friend, then maybe they won't hurt me. And this is again on an unconscious level. And this can be misconstrued as consent. This is not consent. And these responses perpetuate a lot of regret and a lot of embarrassment and shame. So, this is where rape shame comes in. Why didn't I scream? Why didn't I yell? Why didn't I fight? Um, why did I say all these kind, nice, friendly things to this person that was hurting me? Because in the absence of your prefrontal cortex is offline, you will revert to reflexes and habits. This is why we train. Um, this is why law enforcement trains. This is why military and pilots and EMS and emergency nurses train, because In severe stress, in severe trauma, you will revert to reflexes and habits. This is a great infographic that I found that puts all of this together. So imagine and everything in this happens within seconds. And again, all of this is very unconscious under the surface. So you have a bear, a lion, a rapist, an active shooter, um, a car coming at you. Your initial subconscious thought is that there's a threat. Can I get away? If I can get away quickly enough, I can run away from this and avoid being killed. Um, but again, subconsciously, within milliseconds, your brain realizes I'm not fast enough. I can't get away from this. Okay, can I overpower it? Am I strong enough to fight? So the flee um, didn't work. Can I fight it? Am I strong enough to fight off this attack? No, I am not strong enough. This person is bigger, stronger, faster than me. I cannot fight it off. Okay, then I will freeze. Again, this is that if I pretend I'm dead, then it will lose interest in me and go on to something else. So this is that rape paralysis or that tonic immobility or that collapsed immobility is the fainting goat. I will lay here and pretend I am dead and they will lose interest in me. And then again, the same with that collapse is the freeze or the collapse is I will just kind of dissociate and they won't know I'm here and they will lose interest in me. And all of this is this unconscious attempt to protect yourself and save your life, and you have no control over this response. So 3 types specifically of freezing is you have detection freezing, where you notice something is wrong, shocked freezing, and no good choices. And we'll go over each of these. So the first type of freezing is called detection freezing. So this is the brain's defense circuitry detects something is abnormal. So normally if you are making out on a date, you are talking to your boss, you're watching a movie with a friend, and it has suddenly escalated into something that is uncomfortable. Your boss makes a pass at you. This Netflix and chill, your friend that you trust very much has now done something inappropriate. All movement and thought just stops. So, in a nutshell, the freezing response makes us stop everything. I need to receive more information. This can't be what I think it is. I need to receive more information about what is happening, and I need to wait for my brain to queue up and give me a response. Okay, so I must be imagining this. This can't be happening. My boss can't be doing this. This friend can't be doing this. This date that I'm on, this is not happening. And so you are stopping, resetting. I need some information and I need my brain to tell me what to do. Now, remember what I said, in times of severe stress and life and death situations, you will always revert to reflexes and habits. And again, this is why we train for this. Airline pilots, the military, we train our ACLS, we train, so it is secondary, just an automatic response. We know what to do. We don't have to rely on our prefrontal cortex. We rely on our reflexes and habits. So let's strengthen our reflexes and habits. So then that turns into the shocked freezing. So that initial stopping of movement um, or thinking lasts longer than a few seconds. Your brain gives you no options. Like, tell me what to do. I don't know what to do. And nothing is coming. And so that initial freezing, that could be from a loud bang. Say you're in the middle of work and you hear this loud bang. You have this initial freeze where that doesn't make any sense. Is that a gunshot? Is that did someone drop something? Is that a firework? And everybody has that initial freeze. If you are trained to respond to that, that's where it stops and you're able to respond very quickly because you are trained, that is ingrained into your um, deepest recesses of your brain, not your prefrontal cortex. If you are not trained for that, then you get this shocked where your brain is giving you no answers. I was in shock. I don't know. My brain can't compute that this is happening. I had no idea what I could do. And then someone may remember all I could think about and complete that sentence with a thought or two later with this um, brain. Once your brain is back online, things that seem remarkably simple, even useless or ridiculous. All I could think was, God, please help me. This cannot be happening. People assaulted while being massaged have said, all I could think about was to jump up and run down the hall naked or lie there and just let them finish, wait for it to stop. Rational and more effective thoughts or behaviors don't even arise as an option in the brain. Like, hey, I should yell out. Hey, I should, fight back. Or, hey, there is this weapon within arm's reach of me that I could use. Or the door is open and there are people outside at this party. I could just go out there. Like, your rational part of your brain, I can't emphasize that enough, is offline. So these decisions that later on seem very obvious. Why didn't you XYZ? Because that part of your brain was completely shut down. And this is why I advocate and I speak on this, is because I hear it all the time. I hear it from my husband or hear it from, and he is very educated now. I'm like, why wouldn't she just do this? Or why wouldn't he just do this? Because that part of your brain is shut down. You don't have it online to think of the very smart things that a normal person that you would in normal circumstance, you would have absolutely made that decision. So the only thing your brain gives you is a bad option or even a worse option. So how can we help? Sexual assault victims who had a freeze response during assault may also experience much higher levels of self blame. Why did I just lay there? Someone that didn't yell, didn't do the things that you think you see on movies, or you didn't think that you would do. Oh, I would definitely, if this ever happened to me, I would have. Um, it's not reasonable to expect a trauma survivor, whether it's a rape victim, a police officer, a soldier, whoever it is, to recall traumatic events in a way that they would recall their wedding day. So these things that you know now are very normal. Um, we can prevent a secondary victimization. Why didn't you should never be a question that we ask, because you know now why they didn't, because their brain did not give them that option. Normalizing these reactions and telling them this was a very intentional way that your body behaved, your brain behaved to keep you alive. It did its job. And then returning them power. I give my patients options, even the tiniest little options. Okay, this is what we need to do, but you are in charge right now. I know power, your voice was taken from you. I am here to give it back to you. So if there's anything that we are doing that you do not want us to do, you have absolute right to say no and to tell them each and everything you're doing them and ask their permission. Is it okay if I draw your blood right now? I need to give you this medication. Do you want to take it with water or do you want to take it with this lemon lime Shasta? Any kind of power that you can give back to them immediately after this event is wonderful, is very healing for them. And then to slow down. Remember that I know that time is critical. We have lots of things to do, but they are still encoding and still um, understanding what happened to them. And so asking them, like, I need you to start from the beginning. I need you to tell me everything that happened in detail. You know now that's not possible. We need to slow down. Um, I need you to tell me what you can tell me about what happened. Just so you know, if you don't remember things right now that you remember in a few days or in a few months, that is very, very normal. For you not to remember certain specifics of what happened to you is very, very normal. For you not to remember things in order is very, very normal. You can start wherever you want to start. And again, to normalize these reactions so this person that is already feeling such shame doesn't feel more shame. So you can see these things, you hear these things all the time. I see them on Twitter feeds. I see them on Facebook feeds. I see them in comments on the news. This makes no sense. There's no way. She would have screamed. Her roommate was there. She never even said anything. Why didn't you fight? Why didn't you yell out? Why didn't you? Why didn't you? Do not ask a victim of trauma, why didn't you? They can't even get their story straight. They said this right after it happened, and now a couple weeks later, their story's changed. Now you know why that's legitimate. That is a very real possibility that can happen. No way this is true. No one would have done that. That doesn't make any sense the way she did that, or he did that. It is an evolutionary response to keep them alive. So again, you can see where these things happen all the time. We can do better. Tell me what happened, wherever you'd like to start. The way you are feeling, the way you are acting is very, very normal. Take your time. And again, the biggest thing you could tell them is you did nothing wrong. I know that you are feeling a lot of guilt and shame right now. That is unfounded. Your body, your brain did everything perfectly to keep you alive. That is what it's meant to do. And I'm sorry that you feel this way. You had no control over that. You did not do anything wrong. So with that, that is my closing. Here are some references that I used. I appreciate the time you've taken to watch this, to listen. I hope it was valuable for you in your professional life and in your personal life. Now that when you see things on the news or in your personal life, if somebody comes to you with their story, their personal story of something that happened to you, now you're able to advocate and to prevent the secondary victimization, and letting whether it's your patients, your family, your friends, know that how they're feeling, how they responded during this traumatic experience was very, very normal, and the way that their brain is wired to work, and that they did not do anything wrong. If you have any questions, please reach out to me via email, text, smoke signals, however you want to reach me, and I'm happy to talk to you about this further.